And welcome back to the Wellness Paradox podcast. I'm so grateful that you can join us on this journey towards greater human flourishing. As always, I'm your host, Michael Stack, an exercise physiologist by training and a health entrepreneur and a health educator by trade. And I'm fascinated by a phenomena I call the wellness paradox. This paradox, as I view it, is the trust, interaction, and communication gap between fitness professionals and our medical community. This podcast is all about closing off that gap by disseminating the latest, most evidence-based, and most engaging information in the health sciences. And to do that in episode 63, we're joined by Dr. John Jakicic. Dr. Jakicic is a prolific obesity researcher, and that's the topic that we're going to dive into in this conversation. And this is really a discussion around the complex origin and nature of obesity. Quite often, we're led to think, at least from the popular media, that obesity can simply be reduced down into you don't move enough and you eat too much and you have poor willpower. Now, while certainly not moving enough and eating too much contributes to obesity, it is much more complex and nuanced than that. And that's exactly what we're going to get into in this conversation with Dr. Jakicic. We're going to cover a wide variety of issues associated with the condition of obesity. We'll talk about what some of the research shows, the pathology associated with obesity, some ways to consider approaching this from a programming and a practical perspective. We'll even touch a little bit on weight stigma and inclusivity. So this is a very well-rounded conversation that really uses the depth and the breadth of Dr. Jakicic's research over the past several decades. Any information we'd like to share with you from this episode can be found in the show notes page by going to wellnessparadoxpod.com/episode 63. Please enjoy this conversation with Dr. John Jakicic. Today, we're delighted to be joined by Dr. John Jakicic. Dr. Jakicic, thank you so much for joining us.
Sure, great to have me.
So this is a really exciting conversation because we're going to talk about many things related to your research around obesity. And this is a fascinating topic and far more than what we can cover in 10 hours worth of podcasts, let alone less than an hour. So we're going to do our best to try to consolidate this in a way that fitness professionals can think about how to approach this issue from a more evidence-based perspective. But with that said, before we get into this, why don't you just give our audience a little bit of context on your background that you're bringing into this discussion?
So my actual original training was in health and physical education. So many years ago, and kind of found this affinity for, the exercise science, exercise physiology, chronic disease piece of it as I was going through some of that training. And started way back, I'll date myself now, but in the early 1990s for, working in obesity and physical activity and exercise, and realized that, we were doing these studies where it was like, let's control everything people do. Let's kind of almost force them to exercise to see the effects. And then when I started my doctoral training, it became pretty clear that, that's only part of it. We still have this issue of like, how is it that we can engage individuals to become more physically active? And so most of my career has been kind of trying to bridge this piece between the physiological benefits of activity and nutritional change and dietary modification with the engagement of individuals in these behaviors that are going to elicit that. And over time, we've been able to push the envelope. We're becoming more and more, longer term success. And along the way, we've been very successful in providing information about the dose of activity and how much people should do. So it's been this kind of evolving line of research. But I think the one thing I want to say to the audience is how important it is for us to be able to take that research and translate it. The research we do sits on a journal page in some scientific journal and nobody ever uses it. Well, what's the benefit of that when it comes to this? So hopefully our conversation today can kind of bring some of that from the journal pages to real life experiences for your audience.
Yeah, and I think it's so important to translate that research into practice, largely because there's so much information out there on obesity and weight loss that just sits on the internet that is not evidence-based in the least. And translating the work that you're doing is so critically important. And that's kind of where I want to start to take this discussion. And first, I just think we need to level set around obesity as a whole. So to start the discussion, can you define obesity? And then from there, can you also touch on maybe some of the health effects or ill effects of the state of obesity?
Sure. So, we can think in essence, obesity is excess body weight, or more importantly, excess body fatness. And, there's a lot of debate across the public health sector to the kind of what I'll call the exercise physiology sector. In terms of how you really define that. But from a clinical perspective, we do still use the body mass index. And, as you know, there are some limitations to that. You could have a very large muscular person. And so when you use the body mass index, you really kind of also need to give it the eye test. You look at someone and go, that person, looks pretty muscular. That's probably not a good representation of whether or not they have excess body fat or have obesity. Versus, if we could really, measure body fatness, measure body composition, it's probably the better way of doing it, but it's not really practical in a lot of settings. So you got to kind of bridge this gap. And, the real practical application is give it the eye test. I mean, you can pretty much look at individuals and go, they're probably carrying a little too much body weight, maybe, and some of that weight is excess body fatness. And then, of course, we deal with, obesity in the abdomen, which is can be done with waist circumference and things. So I think sometimes we get too hung up about, well, there's this small percentage of the population where the body mass index doesn't work. Correct. Yeah. But for the vast majority, it works pretty well in defining people who, have excess body weight and body fatness. And, along that line, this is probably where the issue is obesity has been associated with everything from, excess mortality, cardiovascular disease, diabetes. We're learning more and more about cancer, and high risk factors, cardiometabolic risk factors. But I think that there's some other pieces that we forget about and we lose touch of, and that is the musculoskeletal concerns that go with excess body weight. And you may not feel those kind of early on, but you keep that on your body for 20, 30, 40, 50 years. It's going to have an effect. And so, we start to see this uptick in knee replacements, hip replacements, back pain. So I think there's this effect. The other part that we lose sight of, sometimes purely is what about the psychology, the kind of psychosocial pieces, the depressive symptoms that some people feel, the low self-esteem that people feel. So I think we have this kind of array of things that affect people where, we really need to be thinking kind of broadly about the health implications.
Yeah. And on the note of health implications, and I'm curious to get your perspective on this because I've read a lot and I have not seen a consensus, and there may not be one. So this just may be your opinion, but the pathology that's associated with obesity, the chronic diseases that you mentioned, how much do you feel, and I'll try to word this correctly, that is driven by being obese versus that's just another part of the constellation of things that develop from that poor lifestyle that you're leading? Does that question make sense?
Yeah, I mean, I think so. I mean, in essence, right, the obesity is a biomarker of, in many ways, lifestyle that are not kind of what I'll say, optimal, right? So at least when it comes to factors in lifestyle that affect energy balance. So is it the obesity or is it the implications of that obesity? And so when you think about obesity, right, one of the things that's associated with obesity is, inflammation, systemic inflammation. So is it the obesity that's causing the chronic condition, or is it the idea that there's inflammation that's associated with obesity that's kind of creating that? So I like to think about the obesity as kind of a biomarker of other things that are downstream that ultimately lead to things. It's not the obesity per se, but the effect that obesity has on things that affect the things that we're interested in.
Yeah, that's a good perspective. And on some level, I wonder if it even matters at the end of the day, what's driving it, because it's the same factors that would address the diabetes would also address the obesity. And maybe that's practically what matters.
Right. I mean, I think that there's the scientific and, the research piece where let's figure it out, because if we do that, maybe we can come up with better treatments, maybe better therapies, these types of things. But at the end of the day, it's about the fact that there's this association.
Mm-hmm.
But you also, might have these individuals who have obesity but have really no other health problems. It's like kind of the quote unquote, healthy obesity. And we've seen that in our own studies, good cholesterol levels, good glucose, good insulin, everything. And so somehow there's some protection. So learning what's different about those individuals who have kind of healthy obesity versus kind of not healthy obesity might be really important in terms of thinking about therapies and approaches that we could be using.
Yeah, and clearly, as you just mentioned, this is complex. This is a very, very complex issue, and that's really where I want to take this next. And this might be the most important part of the discussion, because I think there are certainly a lot of people in the fitness professional community, but just the population at large, and even in the medical community, that simply view this as a issue that is a lack of willpower. You're not moving enough. You're eating too much. And I think if you dig into the research, and I'm sure this is something you could speak to more, that it's clearly more complex than that. So speak to the complexity of this beyond just you don't have enough willpower, you're not moving enough, and you're eating too much.
Yeah. And, at the end of the day, that's energy balance, right? Yeah. That's the difference. But, you can look at this and say, we can look at that simplistic approach. I like to call it a static approach, versus what I'll call a dynamic approach to this process. And to really think more broadly about, sure, you can get in there and go, is there a genetic predisposition? Are there, is your biology not quite set up compared to another person? All that stuff can be true in terms of understanding variability. But I think the other piece that probably is really, pertinent to your audience here is the dynamic approach. That when you touch one side of energy balance, there's this potential implication for touching the other side unintentionally. So let me just give you an example, of that. We know that on average, then when you look at the literature, if you increase physical activity and start an exercise program, that the weight loss on average for an individual is modest at best. However, when you look at that, you say, well, wait a minute, but some people really lose a lot of weight, and some people actually don't lose any at all. And it's not because they're gaining a lot of muscle mass most of the time. It's just they're not responding. And you go, well, what it is when they're, when they're done here, they're being a couch potato the rest of the day, and all these other things. When in fact, we now have research, and we've done some of this. There are some people who, in response to an exercise session, tend to have a satiety effect. Mm-hmm. Others have a hunger response. Whether that's intentional or biologically driven, I think it's some of both. Mm-hmm. But if you have a person who's exercising, and as soon as they're done exercising, the first thing they want to do is run out and get a hamburger. Yeah. You need to understand that, right? And so this interaction, I think, is complex. So it's not as simple as, well, just come and exercise with me. What are the implications beyond that time that they're with you that have some that are impacting this? So it's very, very complex in many ways.
Speak to also the environmental component. I mean, there's a lot of talk. You hear about the individual level interventions, like what a lot of the things you do, but it's also referred to as this obesogenic environment, that we live in. Can you touch on that component for a second?
Yeah, I mean, I think we all can agree that, on every corner in big American, even small American cities, are fast food restaurants, convenience stores, easy access to things, easy access to food. Even during the pandemic, even though we had some, limitations in supply chain, you could get what you wanted. It was toilet paper we couldn't get, not necessarily food we couldn't get, right? So it's pretty easily available, and it's relatively, and you can get food relatively inexpensively. So, but the other part of that is not just the access, but the lack of access too, right? So, what's around you are fast food restaurants, but not good grocery stores, these kinds of things. And just a few days ago, we talked about this, but I saw another post from a colleague about activity deserts, not just food deserts, but activity deserts. And, how can, you look outside your house and there's sidewalks there. All you need to do is put your shoes on and go, but it's more complex than that, right? So it's this environment that's been set up where, we're using cars, we're not being mobile, we're easy access to food. And then you put that on top of the biology that's, kind of counteracting this whole thing. And it's not as simple as do it or don't do it, for sure.
Right. Yeah. And that was kind of the point I was hoping that we would get at is, again, I think a lot of people who are in the fitness industry, because they've lived their entire life as a fit individual, they view it as just a simple matter of willpower and a simple matter of making the right choices. And quite often it is so much more complicated and so much more nuanced than that.
Right. I think that you're right. And I'm also, I think you probably have run into individuals in the health fitness space who actually have made major life transitions, who may have had obesity or chronic conditions and have made a big change. And the one thing I think that they would tell you, if you really kind of probe at them, is how much effort they put into that. It's not like it just happens for them. The amount of time that they might need to spend, in the gym working out or making decisions. And so it's not as easy as making the decision. It's, when you start to think about what's going on in individuals' lives, yes, it's what we're passionate about.
Yeah.
But people have other things in life that are very, very critical to their livelihood, their family's livelihoods, and others. So people can't dedicate 2 hours a day to exercise per se.
Yeah.
So I think we have to be realistic about these approaches.
Yeah. And you said something that got me thinking, and I think about this and I talk about this a lot. It's the message that we promote from an evidence-based weight loss perspective is very much at odds with the commercial weight loss industry, right? Like I often say, no one would click on an ad that I put on Facebook that says lose 8 pounds sustainably in 8 weeks. Like no one's clicking on that ad. To what extent from your view, does that impact the general public's expectation around how quickly weight loss should occur?
I think it impacts it a lot. And I think that, we've actually known for now some time. There were some interesting studies published by Gary Foster and other colleagues who, even when individuals come into weight loss programs, we know kind of what the average effect can be. Mm-hmm. And what we found was that individuals who come in actually have expectations they're going to lose 3 or 4 times that amount within a relatively short period of time. So even the expectations of not just how quickly, but then how much are high. And, there's some downside to losing it too fast, honestly. Yeah. We did some of the studies many years ago on very low calorie diets where, we were, nutritionally good, but, 500 to 800 calories a day of kind of, shakes. And what we found was, and when we combined that with exercise, either resistance training, cardio training, or combined supervised 4 days a week, the effects of exercise got washed out because the weight loss was so great and the body was just trying to keep up, right, with it. And it was like, wait a minute, we started losing some of the effect of the activity. So in some ways, we got to think about, like, are we in it for the short run or are we in it for a lifestyle? And, and so I like to use the term lifestyle. This is a lifestyle change, not a weight loss program, right? And if we go from that approach, we realize there's going to be ups, there's going to be downs, but we're in it for the long haul. And I think that's kind of the philosophy that we need to kind of start to instill a little bit better, knowing that the public still wants to lose it fast and a lot very quickly.
Yeah. And let's stay with that notion for a second of, what people end up losing versus their expectations of what they can lose. Talk about what true clinically significant weight loss is, because I don't think most people understand how small that number is relative to what I think the broader societal expectation is.
Yeah. So, I mean, we'll put it in percentages and then you can, extrapolate that. But, you start to see nice changes in a lot of cardiometabolic risk factors and other chronic disease risk factors with as little as, 5% weight loss. Yeah. We've published some additional data recently where, to really impact kind of the onset of cardiovascular disease and the kind of the onset of the chronic conditions, maybe a little, more like 10%. But for the average person, that's probably 15, 20, 25 pounds. It's not undoable, right? Yeah. It's within our grasp of doing that. The other thing that I think is really interesting around, this is, when you look at acute effects on certain things like glucose, insulin, you don't even need to lose any weight to have acute effects of physical activity, some dietary change. You can get that within, one bout of activity or across a 7-day period. So I think that, kind of thinking about that, you can start to get these benefits, knowing though that a big driver, when we've asked people what motivates them, when they've come into our program and said, what's motivating you? What's your motivation for doing this? I can tell you that things like moving my blood pressure, moving my cholesterol, the things that the medical community says are important, are not their highest priority. Their highest priority is, I want to feel better. I want to look better. I want to be able to be functional. I want to go up the steps without getting out of breath. I want to be able to play with my kids and grandkids. It's quality of life issues. Yeah. And I think that when you think about that, the amount of weight someone has to lose to have quality of life issues is actually even far less than maybe cardiometabolic benefits.
Yeah, and I think that's such an important point for everyone listening to understand, is that we're not talking about the biggest loser weight loss here of 50, 100, 150 pounds. As you said, you're literally talking about 15 pounds to 20 pounds for clinically significant improvements in biomarkers, and then maybe even no weight loss for a noticeable improvement in mood, affect, and just ability to be functional during your day.
Yeah, no, I think that's exactly it. And I think the other challenge that the health fitness industry faces right now, and it kind of comes and goes, but, we now have, in the last few months, 2 pharmaceutical agents, 2 meds that have come out, semaglutide and tirzepatide, I think I'm saying those right, that are been shown to be pretty darn good in terms of weight loss. Now, some of those are a bit expensive. They're not as accessible. But the public is hearing about this and they're going, oh gosh, I can take a pill or take a shot and look what's going to happen. And I think as a from the health fitness side, we can't say, don't do that. It's kind of like saying, don't do bariatric surgery for someone that, really wants it. Rather, I think we need to think about, how do we position ourselves to have a role in that treatment plan? Exactly. How do we fit into the medical management piece, as opposed to saying it's us or them? And I think that creates opportunity for us in the health fitness space as well. And I hope that your listeners kind of can embrace that concept a little bit.
I'd like to take a quick break from today's episode to tell you more about one of our sponsors. As all of you are well aware, the COVID-19 pandemic has been absolutely devastating for the fitness industry, with upwards of 1/3 of our clubs closing nationally on a permanent basis. One of the few stabilizing forces during this very tumultuous period of time has been URSA, the Global Trade Association for the health and fitness industry. On my crusade to make fitness professionals part of our healthcare continuum, the work that URSA is doing is absolutely vital. They provide advocacy and lobbying support at both the federal and the state level. They support state alliances in many ways, and they also provide resources and best practices to club owners, operators, and individual fitness professionals. Indeed, if we are truly going to become part of the healthcare continuum, we must speak with one unified voice. We must have best practices that we implement, and we must come together as an industry to ensure the public, the medical community, and lawmakers hear our message loud and clear, that movement is medicine and it is essential. That is the work that URSA is doing. They've recently revamped their membership structure, allowing large clubs, small clubs, boutiques, and individual professionals to join the organization for an appropriate price that allows them to have access to all of these many great resources and allows us to unify and amplify our voice as an industry. For more information on the amazing work that URSA is doing, go to their website, ursa.org. That's IHRSA.org, IHRSA.org, to look in a little bit further into the work URSA is doing to unify our industry, to move us closer to being a part of that healthcare continuum. Now back to today's episode. Yeah, you nailed it. The idea of it not being, us versus them, it's we are all part of this multidisciplinary team. And I know those are things that you've been involved with throughout the course of your career. So it's a critical point.
Right. And I think the other piece of this whole thing, and we've done a lot of this work, is, how much does someone have to do from an exercise or an activity perspective? So many times we get stuck in this guideline mentality, right? And somebody they may have read one of my papers that says, oh, you need to do 250 to 300 minutes of activity a week and blah, 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 blah. Nowhere in those papers do we say that everybody has to do that.
Right.
That's kind of what what we found. Now, I think that we could think about this kind of more in a pure application. If before we start talking about 250 to 300 minutes a week, let's talk about 100 minutes a week, right? Yeah. When we get there, now let's talk about 125. Yeah. Now let's talk about 150. And we might get to a point where a person is doing activity and we're seeing effects that we're getting those effects and not having to go to 300 minutes a week. So I think we can take this kind of more practical approach to thinking about building activity into people's lives, as opposed to it's kind of an all or nothing kind of philosophy.
Yeah, and that's such an important point you make. And I always talk to my students about this. Research reports means. It doesn't report individual data points. And there's variation. And the other thing that you said, which I think is such a salient point, is that probably the most important 15-minute increase in physical activity in a week is from 0 minutes to 15 minutes, not from 135 to 150. That's
absolutely, correct. The data are clear that, moving from nothing to something is where the biggest part of the slope is, basically. And I think that's the deal. And, one study we did, and, it gets a lot of play for a lot of reasons, but it was our 10-minute bout studies that we did where, you can divide activity into brief 10-minute bouts throughout the day, as opposed to, doing it all at one time. And that gets play because it's practical. But what we found that saying, this is critical, is while we prescribed, a 10-minute bout, what we found over time was that individuals gradually went 12 minutes, 15 minutes, 17 minutes, because the heart, the biggest benefits at the early part of that curve, but the hardest thing for people to do is get moving. And then they realize, wait a minute, I can go another city block. I have a few more minutes I can be out here. It's how do we help people to get up and start going, and that whole, an object in motion remains in motion, an object at rest remains at rest. It holds when it comes to starting to think about moving people for physical activity.
Great. And you just took this kind of exactly where I wanted to go, which is a lot of fitness professionals that are listening to this, that, the objective reality is, and I've been in the commercial industry for 22 years now. I don't train clients anymore, but when I did, I can tell you, the vast majority of people that walk through the door, I say, why are you here? And they say, I want to lose weight. How should fitness professionals, and this is a very broad question, so we'll break it down however you want. How should fitness professionals approach working with an individual who is looking for, even that modest amount of weight loss, but in many cases, much more? How should they begin to think about that process?
Well, I think the first thing is that, in January of every year, fitness facilities fill up, and by the end of February, early March, a lot of people have stopped coming. And I think that it's because a lot of people present for, I want to lose weight. And then, by, I don't want to say just getting them to exercise, but getting them to exercise doesn't give them the weight loss that they're looking for.
Right.
So I think first and foremost, we need to be realistic that for the average person, coming to the gym 3 days a week and making no other changes in their lifestyle is probably going to have minimal effect on the scale and on their body weight. And we have to be honest about that. That's true. There are some exceptions, but let's be true. So, and I think we have to be honest with our clients, about that as well. So I can help you on this side, but there's also this other piece. You coming to the gym doesn't mean on the days you come to the gym, you can go and have your extra hamburger that day, right? We have to think about that in one way. The other part of it is, there are going to be people that jump in, again, you said it, these, health fitness professionals have been doing this for time. We live it, we breathe it. It's what we do. But there's a lot of folks who don't have a lot of confidence in the fact that they can even walk into the gym and know what they're going to do, right? And talking to them and using lingo that, you say, well, it's going to increase your VO2 max. What the heck is that, right? So talk to them in a way that makes sense. Don't talk down to them, but talk to them in a way that makes sense. And the other part of that is, you know, not all the equipment that we use in gyms is built for individuals with overweight or obesity. It's going to be a little bit difficult. So be a little bit selective about that, right? I mean, until a person starts getting comfortable, maybe you don't need to have them on 14 different machines and it's difficult. Start with the ones that we know we can get working on, and also kind of some of the typical things that you might do might not be very realistic for a person with overweight or obesity. So I think that just think about what they're thinking about. Okay? Think about where they are, because this person isn't a person that's out training for a marathon or has been lifting weights all their lives. There are other issues here that we need to be thinking about. And I just think that being realistic about that would actually make the person feel a lot more comfortable in those settings.
Yeah, and I think those are such important points, because there are things that the fitness professional doesn't necessarily consider. Like I've never had to go into a fitness center and wonder if I can actually fit in the hip abduction machine, as an example. And that's just this one small example of the challenge.
Right. And, and there's a reason for individuals who have probably stayed away from exercise the way we talk about it. We like to say physical activity, but let's, call it what it is. When they come to a gym, it's exercise. Whether it be, there's those people, I don't have time, it's inconvenient. But there's also some people who say, I don't like the way this feels, right? I don't like to be completely out of breath when I'm done. I don't like to do things that vigorous. And I just remember a story. It's not a fake story. It's a real story from a person that was in one of our research studies. And as part of that, they said, well, I'm going to join a gym and start going. And they got a personal trainer. And I don't think this is the majority of personal trainers by any means, but this is how it can be. And they came back one day and said, I'm just hating this exercise. I'm like, what are you talking about? Like what's going on here? And they're like, they told me that unless I get to the point where I feel like I'm going to be sick to my stomach, I'm not working hard enough. And it's like, wait a minute, that's exactly the opposite of what we want to be doing. So I think we just need to be a little bit more tactful and understand that, there are other pieces of this pie that are not typical to the traditional exerciser who's been doing it for 10 or 20 years.
Yeah, and there's the two directions I want to go before we bring this to a close. The first one goes back to what you said earlier: is fitness professionals have a scope of practice, and we can help with a piece of this, and that's clearly the physical activity and exercise piece. But it's not necessarily within our scope to work on the nutrition element. So talk for a second about the need for collaboration, working with a multidisciplinary team, referrals. How do you view that?
I think it's critically important. At the same time, I think that we have to be realistic about scope of practice. Mm-hmm. I think what we don't want to be doing as in the health fitness space as exercise professionals is going beyond what is realistic in terms of nutritional counseling and things. I think that there are things you can say, well, you know what, if you look at your calories, you're eating 3,000 calories a day, you probably should be at 2,000. I mean, you can make general recommendations or look at these things. This one's high fat, this one's low fat, or whatever. I think we can make some of those recommendations. I think when you get more into chronic conditions, you want to be a little bit more careful than that. But I think we also have to be realistic, and this just happened to me the other day, where on the other side of the coin, and this is maybe this is ammunition for the health fitness professional. There's a lot of things that other people in the weight management space don't know, but they do. So you take registered dietitians. Their scope of practice is not exercise the way we talk about it, right? And so, we can benefit them just like they can benefit us, right? And I think that we have to make this kind of, but this linkage, right? But I think the other part that I would encourage the audience to think about is, what about the behavioral concepts that go into this? This idea of just telling someone to do it. There are behavioral pieces. And so having, not that you need a clinical psychologist on your team or anything like that, but learning from that part of the profession as well, in terms of how do you really help people make meaningful changes in behavior. Mm-hmm. So it's this concept of this broad group of individuals who really kind of come together. So I think being part of a team and staying within your scope is really important, but it doesn't mean an exercise professional can't implement some concepts of behavior change, can't implement some concepts of good nutrition and healthy eating. But it's I think it's a little bit of all of that.
Yeah, that's great. Yeah, knowing what your boundaries are, and there is the behavior change piece. In fact, in episode 60, we just had one of your proteges on, Renee Rogers, and that's kind of her scope. And so all this is part of the mix of what makes this process successful for somebody.
Yeah, it absolutely is. And if it was as easy as saying, do this, do that, it would be easy. We would have solved this problem. And it's not, it's just not that simple. And I also think that we need to be a little bit careful about the idea of, not to deviate here, but the idea of the fitness fatness idea. It's okay to have obesity as long as you're really fit. It's really hard to get really, really fit in the biology of obesity.
Yeah.
And so I think that, there's a balancing act, here that we need to think about, that as you started this, a little bit of weight loss combined with a good, healthy lifestyle of activity and exercise is probably the ticket to success in this whole process.
Yeah, I would love to get in the whole fitness fatness conversation, but that is a separate podcast and a very interesting one. Maybe we'll have you back one day to have. Yeah. But before we bring this to a close, I can't finish this conversation around obesity without touching on weight stigma for a little bit. And the audience may have not picked up on it, but I certainly did. Even the language you use around it, it's not, this person has obesity or this person is overweight. You were very, very careful what the language you use. So just touch quickly, maybe not just on language specifically, but more broadly, the concept of weight stigma and how fitness professionals should think about that.
Yeah, no, and so, first and foremost in the space, it's really people first language, it's an individual with obesity as opposed to an obese individual, right? So it's a person with obesity, just like a person with heart disease, a person with diabetes. So I think that, that kind of adds a little bit of, kind of respect to the individual themselves. And, there is this bias. This has been done, for years. There's been various, there's tools out there, and where we realize that individuals who actually work closest with individuals with obesity also have a perception of them, that obesity is bad. But that doesn't, we have to get away from that. Doesn't reflect on who that person is. It's reflecting on this condition that they have. And I think that, individuals with obesity also report that there's a stigma or a bias that they perceive as well. And I think that, that makes it uncomfortable. So I think that when we start to think about, inclusivity within the health fitness space, we need to really be thinking about that. So let me give an example of what could be good and what could be a little challenging. In some facilities a number of years ago, they ended up with these kind of separate pieces of separate rooms where individuals with obesity could go so that they felt more comfortable and so on and so forth. Well, what we found was that those individuals were saying, wait a minute, I was being separated out. I was actually kind of being pushed aside here. And so that created another stigma, for them. So how do we put an environment together in our health fitness facilities to make it comfortable for them? Do we need chairs that are a little wider so when they sit down? Do we need chairs with arms on them so that individuals can actually, help to get themselves out of that chair? Things like that make it a more comfortable environment for individuals so that they feel more welcome. And I think that's a really important piece of this whole thing.
Yeah, and that weight stigma is, again, a whole nother separate conversation. In the show notes page, we'll link back up to the episode with Kendra Sonneville from University of Michigan that did a great job talking about weight stigma. But Dr. Jakicic, this has been an amazingly informative conversation. This is such a complex topic, and we've just touched on it. And I know you do a lot of tremendous work in this area. Where can people go if they want to find out more about you, the research you're conducting, and the things you're doing?
Of course, they can just search me on the internet. I'm currently at the University of Kansas Medical Center, and so there's a little bio there. I also, on my biography page with the NIH, there's a whole list of my entire bibliography of studies that have been published and so on. But also there's a number of other venues out there where I've given kind of basically these types of presentations. And again, I come back to the fact that, yes, I can talk from a scientific perspective, but most of what people will see about me is that I really am thinking about this from an application perspective. And I think that, understand, I was there. I was working in a YMCA at one point in time. I know what everybody's going through. And so kind of thinking about it from that perspective, I think helps. So, and also they can, if there's really important things, have them, they can find me at the University of Kansas Medical Center, reach out, and I'm happy to share what I can through that.
Awesome. And we'll link up to all that in the show notes page. And yeah, I appreciate the fact that you were in the trenches. I think that there's something to be said for that lived experience.
Yeah.
So, to bring this to a close, and I'm very curious to get your perspective on this, because you're a researcher and you're an academic, but you were in the trenches. And, the thesis behind this podcast and kind of my mission is, how do we bridge the gap between fitness and healthcare? So the wellness paradox, as I view it, is this gap in communication, interaction, and trust between the medical community and fitness professionals. From your perspective, what is the piece of advice that you would give the fitness professional to bridge that gap?
Yeah, I think that's kind of the $10 billion question, right? And I think that one way to do that is make sure that, I don't want to say you're credentialed, but to make sure that you have the street cred when it comes to bridging that gap. Medical professionals have gone through this extensive training, and they have their way. They're thinking in a medical way. So how can you make sure that when you present yourself to them, that they're like, this person knows what they're talking about. They respect the fact that this patient that I'm dealing with has a lot of other stuff happening. And so I think that, having that layer of respect, as opposed to saying everybody's here, to compete in a marathon or in a 10K or something, really adds to this idea that, you're in it for the care of the patient. Because at the end of the day, that's what the medical community is thinking about. So really making sure that you're giving that persona, which is really important, lets them know that you understand that it's different than training someone for an event. You're now dealing with a patient. And I think if we can think about it from that perspective a little bit, that's going to add some street cred to what we do.
Awesome. Have your street cred. Dr. John Jakicic, thank you so much for joining us on the Wellness Paradox.
Great. Thanks for having me. I appreciate it.
Well, I hope you enjoyed that conversation with Dr. Jakicic as much as I did. If you found it insightful and informative, please share with your friends and colleagues. Those shares make a huge difference for us. Any information we'd like to share with you from the day's episode can be found in the show notes page by going to wellnessparadoxpod.com/episode 63. Please be on the lookout for next week's episode when it drops on Wednesday. And don't forget to subscribe through your favorite podcast platform. Until we chat again next week, please be well.